Today we'll be talking about sexual health and reproductive health. And even though it's past Valentine's Day, I believe this subject is relevant all through the year. It's a pleasure to have you with us again.
Good morning, Dr. Pamela. Nice to be here. I'm very happy to be here.
So thank you for it. We have the honor of having you addressing the female aspect of reproductive health, and we have Dr. Denloye who's going to be talking about the male aspect. But could you just first tell us, what is reproductive health and why is it something we should be talking about?
Reproductive health is the part of healthcare that has to do with the areas of the woman and the man's bodies that reproduce, as it were. And by that, I mean, for a woman, the aspects of her body that have to do with getting pregnant, that have to do with having sexual intercourse, that have to do with basically delivering babies. And for a man, it has to do with the part of the body that, also has sexual intercourse, as well as the part that produces sperm for reproduction. So reproductive health is the type of healthcare that encompasses all those areas, including the actual physical areas, what we call the anatomy, as well as how those areas perform, and if there are any problems that or conditions that people, men or women, acquire from when those areas don't function so well. So I'm putting it as openly and as unscientifically as possible. Thank you.
Thank you. It's always, it's always important to break it down, because often when we talk about sexual health, people then think only of STDs or STIs. But obviously that's a big part of it. And it's something that we need to look at and consider. So diving straight into that definition, what is the difference between an STI and STD? Are they the same thing?
They're more or less the same. An infection just means that you are going through an organism, that is not a natural organism to your body, entering your body. And a disease is the condition that you get when you get that infection. So they more or less mean the same thing.
So going over to you, Dr. Denloye, can you tell us from the male perspective how you see sexual health, and why is it important that we talk about it today?
Well, from the male perspective, it's quite important that we talk about sexual health from the perspective of being able to have sex, pleasurable sex, safe sex, and under conditions in which there is no coercion or where anybody is being forced to have sex.
Now, it's actually interesting that you should bring that angle in, because that's also looking at the broader issue of sexual health is, of course, the whole issue of consent. I think it's a big one, it's a broad one, but how do you, because you offline, you started speaking about 5 Ps. Can you tell us what those are?
With respect to sexual health, we need to discuss about their partners. Some people have multiple sexual partners. We need to talk about that. Some people have different types of practices. Are they having oral sex? Are they having anal sex? Whatever type of sexual practices that they do have. Then we then talk about the prevention of preventive measures to prevent STIs, as you said. They use condoms to stop the spread of diseases. And then we now talk about pregnancy protection. How do they get them? How do they make sure they don't get pregnant? Because sex is not only for procreation. Sometimes it's just for pleasure. So having sex without getting pregnant is quite important, especially in this part of the world where we know that contraception is one of the simplest ways of reducing maternal mortality in the whole population. So those things are quite important.
That's really excellent. I so much like what Dr. Denloye just said, especially regarding the fact that, it's reproductive health and having sex is not just about procreating, as is having children, but also about pleasure. And it's important that, in order to achieve that pleasure, young people and, people generally know to protect themselves from getting infected and, doing the right thing depending on the sort of practice that you're having. So those are really key issues, and it's important to bring them to the fore. So another thing that I was thinking about regarding reproductive health and the rights generally, I think sometimes people don't seem to realize that, the degree to which consent and how people's rights are involved, both men and women, but especially women, since they tend to be the people that are, prevailed upon the most when it comes to sexual harassment and violence. It's important to know that everyone has their own sexual and reproductive rights, both men and women, and they should be entitled to them. So one important thing that people should realize is that there are boundaries for everyone, both male and female, and those boundaries shouldn't be crossed. It's such a huge topic, because when you're walking on the street, when young people are walking on the streets, they get harassed for just walking on the streets, especially females. And that's so wrong, but people don't seem to realize it. It's become such a, per se thing. A lot of my students, female students, complain about, when they're in the some markets, how they keep constantly being touched and harassed. And sometimes in the workplace too, it's like that. So it's something, when we talk about rights, it's also part of reproductive health, and Dr. Denloye alluded to it when he was talking about the P's earlier on. Which of the P's is that? Does that refer to Dr. Denloye?
Well, basically, from what you said, this harassment is part of the area where you choose your partners carefully. And we want you to make sure that you don't have multiple sexual partners for obvious reasons.
You said that people shouldn't have multiple sexual partners for obvious reasons. And in fact, those reasons may not be as obvious as you might think. So if you could outline why people shouldn't have multiple sexual partners before you continue, please.
Well, it's strictly from a medical perspective. The more sexual partners you have, the more likelihood that you will develop sexually transmitted diseases. It's a gimme. I'm not talking about the morality. The moral aspect is a different issue. But from a medical perspective, the more you have, the higher your chances. And we all want to reduce our risks of having sexually transmitted illnesses.
And also, the more you get the diseases, the more you are likely to spread them, so that other people will get them. So it's a vicious cycle. You spread, they get more, you also get, so it's really, it's not the best at all to have multiple sexual partners, and it causes so many different problems. It's the same sexually transmitted diseases that lead to terrible conditions like AIDS, HIV/AIDS. Is the same sexually transmitted diseases that leads to both men and, in the women, what we call the tubes, the fallopian tubes. These are the structures that carry the egg, where the egg and the sperm meet in the woman's body to become a baby, that is to fertilize. That same structure gets damaged when there's an infection, a sexually transmitted infection, and it's usually something that is not reversible. So, and women don't tend to know when it happens to them. They just, it only takes one, episode of unprotected sex for it to happen once you get an infection, and it can cause damage. So it's best to avoid it altogether, you know, and the more you have multiple sexual partners, the more likely you are to get those conditions. And when those tubes are people having fertility issues, it's also as a result of these sexually transmitted infections, or STIs, as people call it, STI or STD. And that leads to damage for the woman, damage for the man too. Some of the reasons when they have all these infections in their testes and so on, they can also have problems with fertility. I think I'm right in that, Dr. Denloye, since I know it's men you deal with more.
Yeah, well, you're perfectly right. And another important aspect is that when we talk about cancer prevention, we know that the more sexual partners you have, the higher your risk of developing cervical cancer. I mean, that came out even before the HPV virus was discovered.
Well, that was very interesting, I think, talking about sexual partners. But we had a question that came up during the break, and someone was asking about the possibilities or why sometimes there's a couple and they're faithful to each other, but somehow or the other, there seems to be an infection in there. And then somebody discovers there's an infection, even though the couple are being true to each other. I don't know if Dr. Prof, you'd like to take that to explain how that happens?
Thank you very much. So there are a number of possibilities. One, before they got together with one of them or the other, that's also possible. That's one possibility. You know, an infection cannot just pop up then, really. The only unlikely thing that can happen is maybe these viruses like herpes and another virus called HPV can also stay in the body, and then maybe when the other person is less, his level is low. Even though they are infections, they're not necessarily sexually transmitted. One of them is called Candida, and it's also known as thrush, and it's also known as yeast infection. It has many names, and I keep hitting my head against my hand whenever people come and tell me, oh, they got toilet infection. There's really, and most people can't believe this. The truth is that when the vagina, all these little organisms that you can't see with your eye. Now, some of these bacteria, when the vagina is cleaned of them for whatever reason, whether it's because the woman has been washing her vagina, I don't know why people do that. There's nothing, it's not supposed to smell like roses, so you're not supposed to be washing it out like women do sometimes. They call it douching. Or when a woman has taken antibiotics, sometimes you can't help taking antibiotics. You may have to take antibiotics for something, although you shouldn't go and buy it off from the pharmacy. You should let it be prescribed to you. So if a woman has taken antibiotics, sometimes these antibiotics remove the normal bacteria that should be in the vagina, protecting the vagina. And then women now develop some of these, what they call infections, which are just discharges. They start getting irritated down there, and they think that maybe somebody has given them an infection or that they've gotten a toilet infection. There's nothing like that, like I said. We know why these things happen. Some people are more prone to it than others, and they keep getting it. So that's an example. And what you do, you go to your GP or your gynecologist and get some treatment for it, and it's sorted. Thirdly, another one that is not that common. So that second one is one of the more common reasons why you would have that kind of thing. And most of the time, you don't even have to treat the man. The woman alone is okay, because like I said, it's not usually sexually transmitted unless it's been going on for so long. Sometimes then you treat them for both the candida as well as something we call bacterial vaginosis, but that's another story. Now, talking about the third possibilities, sometimes, and although this is rare, during the act of sexual intercourse, it's possible to transmit the area of the woman or around the anal region, into the vagina. And sometimes that theoretically has been known to also go ahead and cause infection. And, both of them start passing this around. So those are the three explanations, and they can be treated. Basically, whenever I have any patient, any couple that come with an infection, I always tell them that, look, there's no need to fight each other. This thing can happen for whatever reason. Just treat, both of you take treatment, and let's move on with our lives. So it's not necessarily that somebody gave somebody. These things just happen sometimes. I think Dr. Denloye will probably have had some experience about that kind of thing as well. The other thing I'd like to talk about after he's gone is he's talked about this is contraception, how to prevent some of these things. But over to you, Dr. Denloye. Have you had that experience where you have couples coming, and how do you handle it?
Yes, this happens regularly in family practice, and we have to spend a lot of time explaining to them that the fact that it's an infection does not mean that it's a sexually transmitted infection. That the ones we call sexually transmitted infections are only transmitted through sex. These other ones, you can get them through other means, and it doesn't have to be through sex. And to add to what you said, sometimes if they have a poor hygiene, because of the closeness of the anus to the vagina, sometimes if they're not if they have a poor hygiene, you can actually have a direct spread of some bacteria from the anus directly into the vagina without having sex. So these things do happen, and we try to teach them and explain to them the sources of this infection. And truly, most of the time, we rarely have, in my own personal experience, we rarely do have situations where this infections, this serious sexual transmitted, more with single individuals, from my own experience, than with married couple. I'm not saying it doesn't happen, but it's quite.
So if we can just talk to us a bit about the common sexually transmitted diseases that we find here in Nigeria. What would be the top three?
For me, my experience is mostly gonorrhea and herpes infection. I've not had quite a low number of syphilitic infections. But of course, there are other types of infection.
Yeah, chlamydia is another one too that we see. The only problem is both, especially chlamydia as well as gonorrhea, oftentimes for women, they may not even know they had the condition. Meanwhile, it's damaging there. So that's part of why it's important to protect and prevent, as opposed to wait for it to happen and then if you think you can treat it.
So talking about protection and prevention, Prof, you're going to talk about something to do with contraception and how it works?
Yes. So one major thing that has baffled me all my gynecological career in Nigeria is the reticence and fear of contraception in women. I just don't get it, because it's as if some women would rather have 5 terminations of pregnancy or 10 than use contraception. It doesn't make sense. And what do they tell you? They tell you that it has side effects. Excuse me, pregnancy has, and contraception, that's one. Apart from that, having to terminate a pregnancy has even worse connotations, especially since a lot of women have to go underground to go and have it done. So it is very, very baffling to me. And the truth is that contraception actually does not cause you any problems. It does not stop you from being able to get pregnant. It does not it does not give you cancer. There's so many things that people, no, it has side effects. Paracetamol has side effects, for goodness sake. Are you going to say you won't use it for a headache? So there's nothing that doesn't have some degree of slight side effects, but contraception does not stop you from getting pregnant and does not make you infertile. On the contrary, it helps preserve you, prevents you from getting pregnant and unwanted pregnancy, and things like condoms prevent you from getting sexually transmitted infections. So it's really important to, you know, protect both from sexually transmitted infections and pregnancy using contraception. I go on about it a lot. Excuse me. People think that the pill, the contraceptive pill, you know, is bad. It causes breast cancer. It causes all sorts of cancers. But the truth is that it doesn't. So sometimes if you have maybe 100,000 women using the pill and 100,000 women not using the pill, out of the ones using it, maybe 30 will have the 30 out of the 100,000 have a slight risk of having some blood clots in the legs that we call thromboembolism, whilst for people who get pregnant would have 60 times the risk. So, I mean, it's usually better to protect yourself.
Thank you. Now, I mean, just as the conversation is heating up, unfortunately, time is run out. Do you have any last words for our listeners for Denloye?
Yes, what I tell my patients in terms of contraceptive is when they talk about side effects, it's like, look, you've entered a car to come to the office this morning. Obviously, every time you enter a car, there's a risk of having an accident. But that doesn't stop you from entering a car to come to the office or to go to work. The risks are so low that you don't even think about it. And I also tell them that, look, this is the only time in which we're actually empowering the women. We're telling you that
excellent,
it's your body, right? Take control of it. Determine when you're going to get pregnant or when you don't want to get pregnant. Be in absolute control. God has given you the body and you have to protect it. You have to protect yourself. So taking contraceptive just means that you are in control. And sometimes when you tell them that, they begin to see it from a different perspective. I don't want my body, you know. So from that perspective, some of them listen. But as Prof said, it's a big, you know, they say it with a matter of pride. I don't take contraceptive. I don't take contraceptives as if, you know, it's a taboo. Even in corporate organizations, there's still quite a lot of done in that regards. But we'll keep trying.
Thank you, thank you. So, Prof, do you have any last words?
No, just to say, you know, that I'm really pleased that Dr. Denloye agrees with me on that, and even that car analogy, I'll start using it myself. You know, but women and men should really take care of their reproductive health. It's too important because in future you want to have children, and one of the worst ways of getting yourself infertile, one of the easiest ways of getting yourself infertile is by not using protection like condoms when you have sex, or not using contraception when you want to have sex so as not to get pregnant. Thank you.
Thank you for watching. Please like, share and subscribe for new video updates.